Good evening and welcome to Conversations. This evening, we will be discussing managing your health in a COVID environment. I now invite Ms. Sandra Brown to lead us in a word of prayer.
Let us pray. O gracious Father, your love and compassion never fails. We humbly come before you tonight and mercifully ask that you heal us all in body and in mind. We remember before you persons who feel burdened, oppressed, tired, destitute, worn down by pain, illness, and disease. Those who are bereaved, the aged and the weak. Comfort, help, and relieve them according to their several needs and your great mercy. Guide the thoughts of the panelists tonight and allow the participants to be receptive to the teachings that will enable us to effectively manage our health in this COVID environment. Be ever present with us, Father. Uphold our faith, cast away all fear, doubt, and anxiety that would distract us from trusting in you. Keep us safe and give us the peace in our hearts, the strength in our bodies, the wisdom, courage, and endurance needed to fight this battle and to be victorious. All this we ask in the name of your Son, Jesus Christ, the great physician. Amen.
Amen. Thank you, Sandra. So some small housekeeping matters before we begin. First of all, I'll introduce myself. Now, there is a possibility that the media is in attendance, and from time to time, your comments may be referenced in their articles. We mute all mics, and we ask that you use the raise hand icon if you wish to ask a question or participate in the discussion, or you may type your comments in the comment section so that we can pose those on your behalf. So this evening, we will be discussing managing your health in a COVID environment. Now, why did we choose this topic? Well, as we look around the world today, we see the challenges that our healthcare system is facing. It is overburdened, our medical practitioners are overwhelmed, and all of this is from the impact of the COVID-19 environment. Persons in need of regular health care are sometimes fearful of going out to get that health care because in some cases they don't want to mix or mingle too much with the other persons out there in the fear that they will contract COVID, or there's simply not enough hospital beds or access to appointments because medical practitioners are so overwhelmed with caring for those who have contracted COVID. So what happens? In some cases, we don't exercise anymore. We're fearful of going to the gym. Some persons don't, they're fearful of going out walking. So at the end of the day, what eventually happens to us? Eventually, all of this will have an impact on our overall health. And so this is why tonight we've put together a panel of two medical practitioners. We welcome back Dr. Russell Broom Webster. He's the PRO of BAMP and the lead physician for Transitional Community Care Program at the QEH, and he will share his medical expertise. We also have Dr. Damian Henry, and Dr. Henry describes himself as an elder at the Gazette Seventh-day Adventist Church. He's a medical doctor by profession who has been practicing medicine for the past 21 years. He's the managing director of Bridgecott Wellness Center, where his motto is bringing persons to Christ through health. And last but not least, we have the lone lady tonight who shares my name. Her name is Lana Richards. She is a certified personal trainer and nutrition coach with the ABC Fitness Center. So welcome, lady and gentlemen. I now invite each of you, beginning with the lady first, to say about 5 minutes to present on your topic, what you would like to share with as your opening words with the group tonight. Lana?
Hi, good evening, good night, everybody. As Lana introduced me, thank you for having me. I am a certified fitness professional and nutrition coach. I am happy to be here. I am a firm believer that health is your first wealth. And I think in this COVID environment, it has been abundantly clear that taking care of your body and taking care of your health has to now be a priority. A healthy system really is a resilient system. And in these times, we really need lots and lots of that. The question is, how best can we maintain a healthy system with all that's going on around us? And it can be difficult. It means carving out lots of time and changing up our schedules and making it a priority. I really would like to, change people from if I have time, I will, and if I have energy, I will, to I'm making time for this because, we are all under stress. It has been a very stressful environment for the last couple of years. And exercise and movement can be one of the greatest de-stressors. I challenge anybody to simply get out there and move 3 days a week, daily if you can, and see how it changes your body, the way you feel, and really how it can improve your quality of life.
Thank you for that, Lana. I should also say that I can attest to Lana's effectiveness because she is my trainer, and she really ensures that I get up and move at least 3 days a week or more. So thanks for that, Lana. I would now go on to Dr. Russell Broom Webster, who is no stranger to the Trinity Chapel, as he was with us a bit earlier in the year when we discussed COVID itself. So Dr. Broom Webster, perhaps you can share with us at this point.
Hi, good night, everyone. My name is Russell Broom Webster. As Lana mentioned, I'm a family physician. I'm also the public relations officer for the Barbados Association of Medical Practitioners. I think it's a great opportunity to have this conversation. I would preface the conversation by saying welcome to the other panelists. Lana, I know Lana well. I also know Dr. Henry as well. And in a way, we've all been working very hard to keep people safe through education, through our various modalities of treatment, whether they be exercise or whether they be medical intervention, as well as supportive care. And, it has obviously been a very hard time, but I think the word tonight is resilience. And certainly groups like this where there's a strong faith-based community, are good examples of ways that we can come together to engage our communities to make the future better and to actually lead us out of the pandemic into a future that starts to make sense or starts to feel more comfortable. Unfortunately, COVID-19 has converged on a health environment, not just in Barbados, but in the world that has many, many challenges that were there before COVID, and they've all become much more complex after COVID-19. And that's at a national level as well as a community level, and certainly a personal level for each and every one. Here, for myself, I've had significant challenges with anxiety myself, not working out. And as Lana says, sometimes you just have to get up and do it, but we can be each other's biggest motivators and help us get to a point where we start to get back to normalcy. I guess the only other thing I would say is we've made it this far, and congratulations to everybody. It may feel like everything is quite overwhelming right now, but certainly there are lots of things available to us in terms of knowledge, medical intervention, understanding how to move forward that we didn't know initially, as with most things, and we will continue to learn and get better at adapting to life within the context of COVID-19, as well as all the other healthcare issues that were there before. So I just want to encourage everyone to stay positive. Certainly, it's going to be important to stay strong in your faith, and to stay strong in your community, because all those things will certainly be the bedrock or cornerstones that get you through this very difficult period.
Thank you, Dr. Broom-Webster. I now invite Dr. Henry to share his comments.
Hi, good evening, everyone. It's a pleasure to be here. Good evening, Russell. Good evening, Lana. Lana. Well, the thing about it is that, as Russell said, this is a very difficult time for most persons. And one of the things that we've realized in the medical fraternity over the last, I would say, 2 years or so, is that persons maintaining their health, or the general health and well-being, is actually a basic struggle. Not only the physical aspects of health, but also the mental aspects of health. A lot of support networks that people would normally use and would rely on, for instance, or the body of faith here, the church family and those kind of things. A lot of these have been kind of disrupted, and your contact with individuals and stuff have also been disrupted. Both individuals spoke about maintaining your exercise routine and those kind of things. And all of these are challenges that a number of persons would struggle with over the last year and a half, heading to 2 years. The other thing that for a lot of people has been compounded this is basically in terms of how to access medical care and how to be able to navigate what is happening in both the private and public arenas. I know a number of persons initially last year were very scared to go to the doctors. A lot of doctors were very scared to open. And so in terms of people who had the chronic, non-communicable diseases, the diabetes, the hypertension, and things like that, a lot of these persons found themselves kind of like on their own, trying to kind of wing it. Some of them no medication for months, some not seeing a doctor for months, and all of these things were a challenge. This year, compounding that further, in those persons who access care in the public sector, a number of the polyclinics were actually transformed into like testing sites or sites, and subsequently sites for things like vaccination. So in terms of the general health care that was available there, some of that was actually disrupted. And so I think that significantly kind of pressured, created an environment where people's health and how they look after themselves kind of deteriorated over the year. And the challenge now is basically how to get back on track, how to keep yourself where you should be. And the first rule of thumb is basically, yes, it is a scary time out there. Yes, there are challenges in terms of our community, in terms of the rising numbers, but you can still access care both for the public and private sector, but you just have to make a planned event in terms of doing it in a wise way. Key tips in terms of having a good rapport with your family physician. If you're in the private sector, find out when is the best time and schedule the appointments. Some offices have a kind of a waiting system where you come and you would actually kind of wait in the car park or whatever, or they will tell you to come at a specific time. So these are little things that you can actually do to kind of plan and still maintain, having your checkups. The other thing is basically in terms of having a good rapport with your pharmacist, because sometimes you may not be able to get an appointment or whatever at the appropriate time, and you may be a little short on some pills. And I know a lot of pharmacists at this time, because of what was happening, were cutting people a little more slack in terms of repeats on prescriptions and stuff like that. So having that rapport there as well is important. And these are just a couple little tidbits that you can actually look at in terms of getting things sorted. From the public sector, no, I think that's a little more tricky. The whole idea then is understanding which days are clinic days, and for those persons who have significant challenges, what to do when you go to the clinic in terms of highlighting these to the appropriate persons to say, well, look, hey, I am not feeling well today. I need to have X done or Y done, so that you can be shunted in the correct direction and have things settled where you need to be. Not everyone has the financial resources to seek care privately. But in the public sector, once you voice yourself and express yourself correctly, what can happen is that these individuals can actually, be shunted and they can get access to the care that they need in the correct manner and the correct way. Mental health, last wrapping up point, is basically a vital thing. And the number of persons during this time, depression, anxiety, have been some of the key points that people have been suffering from. And there is a fairly robust mental health system in the public sector. Dr. Joy Su, I think initially in the first couple of what they had, these press conferences, she came on a couple of them speaking about mental health and mental well-being. And at all of the polyclinics, there is a mental health practitioner there. There's somebody who is a resident psychiatrist, who you can actually make appointments to see, and these individuals can then put you on to counselors and that kind of stuff. You also need to know what are your resources within your church setting, because I know a number of churches offer counseling at a reduced cost or free. And I think this is one of the areas that you can, be a significant witness or have a significant ministry if you have that skill set, to reach out to your members who are having different challenges. And these are people that you can actually tap into. And then should you need to go further, then you can actually go to the next step in terms of seeing the psychiatrist. So just a few tips. Maintaining your health, exercising, and those kind of things are important. And a lot of that stuff helps in terms of if you have if you have a good exercise program and a good stress relieving techniques and stuff like that, and you have a more balance, you're less likely to you're better able to cope with the stresses of the actual COVID environment and the changing society that we are living in at this point. Leave it there for now.
Okay, thank you, Dr. Henry. So I'm going to go back to Lana Richards for a bit. And I would say that when COVID really started to get a bit worse in Barbados, I think it was around maybe we had the last lockdown. And I said to Lana, well, I'm not quite comfortable coming back into the gym environment. And let's work with what can you do to help me to maintain a balance of exercising, because I myself I've been working from home for more than a year now, and I recognize that because of that, it's even more important for me to maintain a level of exercise. But I realized that working out in the evenings, which I tried, was not the best solution for me either. So Lana and I worked together, and we were able to come up with a plan that worked best for me, that I would be able to maintain my level of exercise to allow me to achieve that balance that I really needed to achieve. So Lana, maybe now you can share some tips with the audience in terms of what could they perhaps do differently, some of the things they could perhaps do if they don't want to go into the gym, what their options are, and maybe tap into a little bit in terms of eating as well, because we also know, particularly with COVID, that keeping our bodies strong is also very important as well in terms of the vitamins and the nutrients and so that we need to ensure that we consume. So perhaps you can share some tips with us.
Sure. So firstly, I mean, like you said, it is difficult with most of us being home. Most of us are behind computers, even me myself. I never used to be behind a computer at all. And I find myself there a lot more now. We are, like you said, working from home, dealing with homeschooling, all of these things, which I think require less and less movement from us. And therefore, I think people have to recreate um, a new routine. Sometimes it can be hard to find the time now to get out and get to the gym or get out and do what you used to do. For me, myself, I never used to like working out at home. So when we were locked down, it was very, very difficult for me to get past the mental aspect of, oh my gosh, I have to like attempt to find a space in what was my relaxing haven at home, to find a space to really be able to get my head right and be able to, exercise and sweat it out. Um, so I think that firstly is one of the things. Either find a space within your house, within your curtilage, just outside your house, that you can use, that you're comfortable using. And if not, exercise is simply movement. It's movement in a way that helps you either sustain or improve your health. It doesn't have to be a weight training session. It can be a walk around the neighborhood. It can be going to the beach and swimming. It can be walking on the beach. It can be yoga. It can be biking, cycling. You really have to find a movement pattern that is easy for you to incorporate into your weekly, if not daily routine, and something that you can fairly easily and consistently do. Not everybody is suited for barbells and heavy weights and kettlebells. And we have to understand that. And we have to be able and willing to work with everybody on their own journey. I think we as trainers and nutrition coaches now have had to get very creative in terms of working with people with what they have and where they are, and being able to try to motivate and push people along, because it has been very difficult for us as well as everybody. It's been very difficult to get past the mental hurdle of, how do I do this now, because this is not my norm. So it is creating a new routine for yourself, carving out the time. It is, I know it can be hard, but 20 minutes to half an hour, that's all you need. Sometimes 15 minutes. You and I both know we can get it done in a short space of time, right? So you don't need a whole lot. And everybody, I don't have an hour. I said, you don't need an hour, right? Find just a little space. And like Dr. Henry said, it leads so much to the mental aspect. That consistent movement. Our bodies were made to move. And I find the lack of movement leads to more depression and more anxiety. And I found during the lockdowns, for me, I'm always moving, I'm always on the go. And so being in the lockdown setting really, really made it, I really then understood, like, oh my gosh, this anxiety thing is real. So I then had to, go for little walks and find ways to do things, skip, even if it was just walking around outside with my son, to find ways to be able to kind of de-stress and move. And I find movement is healing. It really is. As for the nutrition aspect of it, we got to work with what we got. But as far as nutrition goes, the basic things are staying hydrated, water, water, water. You really want to include as much nutrient dense foods as possible. So we're looking at fruits and vegetables, trying as hard as possible to eat the rainbow, eat all the colors, right? We want to get in as much nutrient dense foods as we can and stay away from the sugars and the processed foods as much as possible. I find that we deal with the COVID environment as a stressor, and all of these quote unquote fast foods that kind of bog down our system make it harder for us to deal with the stress. I challenged one of my clients to, instead of reaching for a cake, a slice of cake, to go for a fruit or some other such nutrient dense food that you can quickly substitute. It's sweet still, it's sugary still, you still get that bite, but it's not going to then be a stress onto your system, right? It's really gonna kind of uplift your system rather than bringing it down. But apart from, increasing as much as possible your fruits and veggies, it doesn't have to be fancy. Your local fruits and veggies are just as good as the strawberries and the berries. We have a lot of really good local fruits and vegetables here that are very available. And we just try as much as possible to keep including them in our meals to help support our bodies. And like we said, a healthy system is a resilient system, and that's really what you want to maintain as we go.
Thanks for that, Lance. So now a question that I'll pose to Dr. Broom-Webster. Now I hear all the talk of the benefits of zinc, I think vitamin D, and those type of things, which have been said to have a positive impact on keeping our bodies with the ability to fight off COVID or to help us heal faster if we have COVID. Is there any truth to what is being said regarding those two, for example, those two nutrients?
Thanks for the question. Yeah, so I mean, you would see a lot of interventions being publicized in the various social media spaces, and there's some, I guess you could call it literature that speaks to that. But when it comes specifically to COVID-19, there hasn't really been any evidence that suggests that there's a benefit, particularly with there's been zinc as a protocol. There's been zinc plus azithromycin, zinc plus azithromycin plus hydroxychloroquine, zinc and vitamin D plus other types of cocktails. There's been inhalation and steam. There have been a wide range of things that persons, and then most recently would be ivermectin. And all of these modalities, not that we don't hope that we can find something that really works well, that's simple, that's cheap, but certainly they haven't really been borne out to be effective. And it doesn't mean that they won't be effective with appropriate research and trials and so on, because I don't think one of the conversations that people like to be very binary and say, well, just because something hasn't proven to be true, that it isn't so. But certainly from a medical standpoint and from an ethical standpoint, we're not in the position of giving persons medications that certainly haven't been proven to give them any benefit. And at this point in time, the best protection that you can get from COVID-19 are all the layers of protection that we've been discussing over and over. And those would be non-pharmaceutical or public health measures such as social distancing, physical distancing, mask wearing, hand sanitization, as well as the vaccination. And there are lots of therapies out there being used at this point in time in different levels of COVID-19. We would have seen there's some medications that people would get when they're a little more severe, along with oxygen supplementation. And in certain parts of the world, there are even more expensive medications that seem to be working quite well. So I think the message I would say is that we're constantly searching for better ways to treat and manage COVID-19 in particular. One of those ways is certainly keeping your health in as good condition as possible, which is kind of the focus of tonight's conversation, so that even if you are exposed, you do give yourself the best chance of having a good outcome. Unfortunately, there are many people in our society who do have chronic diseases, who do have diabetes, hypertension, heart disease, suffer with sickle cell disease, lupus, and a wide range of different things who would be a bit more vulnerable. And for them, the messaging is still the same. However, we do recognize that risk is there. But as I said before, we all have to just integrate how we move forward by engaging our community to do all those things which we know to work well. And I think that we will continue to search as much as we can for the right ways to treat COVID. I'm sure in a year from now we'll look back and remember when we first started assessing the response to COVID-19 in particular, there was a big concern about whether masks were appropriate or not. Masks now is a widespread thing. Everyone wears masks. There was a big concern as to whether we would have a viable vaccine candidate, whether we would have any therapies. And we've made great progress. And certainly I think that progress will continue to improve, and we just need to keep up with the scientific rigor. So suffice to say, there's still work to be done in the research side of things, but specifically with zinc and vitamin D, which were the two things you asked about, even though I spoke about other things. Most of the randomized controlled trials are, which a lot have been done in those areas, in those two areas, really haven't shown any conclusive evidence that there's benefit at this point in time in terms of administering a particular therapy like that.
Okay, well, thank you for that. So, Dr. Henry, you spoke a bit in your when you did your intro about access to mental health and professionals and mental health is a topic that a lot of us don't like to discuss. A lot of people have challenges experiencing admitting that they may need some help or someone to talk to, or but you gave a little bit of an insight in how you could access that type of help if you need it. So could you share a bit more on it? Because I know that, as I mentioned before, it's not something that people really want to do. Is there a way that you can do it in a more discreet manner, or, because a lot of people may not necessarily be comfortable going to the polyclinics and saying, I'm having some challenges. Do you have a psychiatrist in today or something? So perhaps you can tell us a bit more about that.
Right. So in terms of, the first thing is to realize that you have a problem. And I think that's where it all starts, in terms of recognizing that, I am not coping as well as I normally would under certain circumstances. And it may be things as subtle as just not having a good night's sleep, Boston turning, anxiety, which is one of the things that, both Russell and Alana mentioned about in terms of, and anxiety attack can be something as simple as, you have a task to do, and you find that, you are, your heart is racing, or you are, breathing quickly, short of breath. Some people experience chest tightness. um, flight of ideas, racing. So you realize that you're not coping. The one of the easiest ways of getting help is actually in terms of having a trusted friend or somebody who keeps you accountable. And in a church setting, this is actually probably very easy because there are people who you trust very much and who talk with. You may be a prayer partner or people that you may have a rapport with on a daily basis, and you can express and say, well, hey, I don't think I'm managing this very well, and I think that's usually the gateway into getting additional help. You may not necessarily be you don't necessarily have to walk up to a clinic and say, hi, is there shrinking? Did I see someone? And I find in our setting in Barbados and the Caribbean, we talk about everything else except our feelings. We don't talk about how we feel. We don't talk about how things affect us. And we tend to kind of keep most things close to our chest. The infamous fear of the green gates. Nobody wants to go Black Rock. Nobody wants to be considered mad or anything. So any words or related to a psychiatrist or psychiatric care that raises some heckles in society. So I find one of the easier pathways for individuals to access is basically in terms of merely just talking to a counselor. And sometimes when I introduce the concept in my office, I just ask people, would you mind talking to someone? I don't put a label because labels, if you say the person is a psychiatrist or psychologist, that means that you have a mental issue. If I say I'm going to talk to someone, someone could be anyone. And, most people feel comfortable, I want to talk to this person. I don't give the person a label and I give them a list of individuals that they can actually go speak to. And I love that to be the gateway. Similarly, in terms of if you have a church setting, you can have, you can set up a support group of persons who people can reach out to, kind of, the Samaritans of your local church. So, these individuals, if you have a problem, you can call this number and you will get someone to talk to, whether it be at 2 a.m. or 6 a.m. or 11 o'clock at night. And that, somebody's there to reach out to you, talk, and possibly prayer, offer some amount of emotional support. That group of individuals then would have a further network of people who they can actually tap and resource. So they will be, if that group of individuals are trained, they'll know, well, okay, these are some signs where we need to get this person on to somebody else, or who needs to, if they need to see somebody, a professional psychiatrist or a psychologist, or they need a few more in-depth sessions. And they can, skillfully and tactfully direct the person in a confidential and discreet manner to, these individuals where they can actually see. In the public sector, I think a lot of people feel very comfortable talking to their doctor about most things. So if you go into the public sector of the clinic, and you don't necessarily have to go and ask where is the psychiatrist, but you can go and you can talk to your GP. You're not going to have a lot of time. So you need to say what you have to say very quickly up front. Just let them know, well, hey, doc, depression, the sugar might be a problem, but I'm not sleeping so good at night, and my heart is racing, and I'm very anxious. And you can say all that in 2 minutes quickly, because a lot of the times, unfortunately, in the public sector, you may not have the time to sit down and have a half-hour chat with individuals, which is part of the struggles that we face, because obviously you have a lot of people trying to get care at the same time, and you have a kind of rationed service, which is unfortunate. But if you mention these things, they can say, well, okay, hey, we can get you into somebody that you can speak to a little more discreetly. And nobody will suspect, because you went to see the doctor who looks after the diabetes, the hypertension, and those kind of things. So it's not that you're going to see, not that you came on Tuesdays and Dr. X name is on Dr. X, the psychiatrist deals on Tuesdays, and you went into that room, so you went to see the psychiatrist. So it gives you a kind of way around. And honestly, a number of individuals who come to general practice, just Russell could agree with me as well, in terms of that a number of persons may come for a particular physical complaint. I may have back pain or headaches or whatever. But once they get comfortable, they will tell you, well, doc, really and truly, having some other problems, could I ask you about those as well? And then they start highlighting the other issues and kind of segue into the emotional struggles that they're having. So you have different ways you can access through your church. You can talk to your normal GP, or even if you go to the public clinic, you can still speak to your GP. The other thing is that there's a mental health nurse at the polyclinic. So even in your booking sessions, when you go to the polyclinic and you're speaking to the nurse who's doing your vitals and stuff like that, you can mention to them that you're having certain struggles, and then they can actually kind of put you into contact with that mental health nurse. Sometimes they're at the clinic more times than the psychiatrist is there, and that can also be a nice little gateway in. And nobody has an issue going to see the nurse because, again, low suspicion. So you're not going to be labeled, that kind of stuff. The other thing that we need to kind of highlight is that basically, we need to also look for signs of distress in our kids, because online school, completely different environment, kind of closeted inside, less interaction with their friends and stuff like that. And kids are not necessarily going to present the same way as adults in terms of, anxiety and stuff like that. Some of them might be more irritable, agitated, a little more prone to fights and stuff like that, outbursts. Some people may just become tearful, in terms of, or you find that they lack confidence, in terms of doing certain things. So they just, just pretend to not pretend, but, helpless, they can't get it done. This is stuff that they would normally do. So these little things in terms of your kids need to also look for. So say where you are struggling, they are struggling as well. So it is an entire family thing. So in terms of looking out and accessing care for them, you can actually take them to their pediatrician. Most pediatricians have a good connection in terms of where you can actually refer your kids to. Number of pediatric psychiatrists about, and counselors as well. And if they're older and they may not want to talk to mommy or daddy or whatever, I think all schools, secondary schools, have a guidance counselor and guidance, which offers counseling, and that they can actually reach out to. And there are appointments and stuff that you can actually set up in a virtual manner, so that they can actually receive, help and assistance that way as well. So that should cover most of the people that we have.
Okay. Thank you for that, Dr. Henry. At this point in time, I'd like to remind all the participants that they can pose their questions in the chat, or you can use the raise hand icon to ask any question that you wish to pose to the panel. But in the meantime, Lana, tell me what my typical meal should look like if I want a healthy plate on a daily basis. What kind of balance should I have on my plate? Would you be able to share some more with us on that?
Sure. So a healthy plate is not our typical Bajan plate. I like to say a healthy plate is half of it is going to be your vegetables. And when I say vegetables, I mean your green vegetables, your lettuce, your tomatoes, your broccolis, those kinds of things. Then your other half then will be divided for your proteins and your carbohydrates and your fats. Now, I know a lot of people get nervous when they hear me talk about fats. When I say fats, I mean your healthy fats. So you're looking at possibly what you may be sauteing your vegetables in, your olive oil, your coconut oil, your healthy fats like your avocados, things like that, that are going to aid your body, not the mellow cream and such. So basically you're looking at half of your plate is going to be your vegetables and or fruits, depending on if you're looking at a breakfast or that kind of thing. And you're looking at the other half being then divided between your proteins and your carbohydrates. That is just a relative thing that people can use to gauge it. a lot of people, they would tell you, you can use your palm. You can say a protein serving is the size of your palm. Your cupped fist would be the size of carbohydrates, and a folded fist is what you want for your vegetables, at least. A serving of fats, they would use your thumb as a serving of fats, which is generally a tablespoon of oil.
Okay. And what if I'm looking for immune boosting foods, or what is there anything in particular I should be looking at in terms, or are there any kind of juices I should be drinking? What about those type of things?
There are so many. It's hard to say. Obviously everybody leans towards, your citruses and your vitamin C's, they're always, but I want to say that all fruits and vegetables play a part. And I tell people all the colors of fruits and vegetables have their very different properties, and all lead towards a very healthy and nutritious plate. So that's why you'll hear me say eat the rainbow, because you want to get in the various nutrients from all the different colors of your vegetables. So yes, we always talk about eating green, our green smoothies and our green drinks and those kinds of things. But it is not just green. You have your purples and your reds and your yellows, and they all play a part in creating that immunity. They all play a part because all of them are nutrients that your body needs.
Okay, sounds good to me. Now I'm gonna kind of go back a little bit to the doctors now. And I want to say, for persons, for example, who you mentioned people who are hypertensive, and we mentioned people who are diabetic, and so how, in reality, how easy is it for those persons, if they turn up at QEH having an emergency, to navigate that system as it is right now?
Sorry. Hello? Let me
Hi.
turn my, yeah, sorry.
We're hearing you.
Yeah. So I guess I can start. I mean, I don't know if I'm sure Damien would want to allude on this as well, but I guess the summary is that right now things are pretty challenging. I mean, I guess it's always useful to paint a picture so that you can understand what the scenario is like. Prior to COVID-19, as Dr. Henry alluded to, and before I move on to that, I just wanted to support, Dr. Damien's advice is really excellent advice. Okay, I mean, for everyone listening on the call, I would endorse everything he has to say in terms of navigating the healthcare system, especially those persons who have to navigate the public system. You really have to be empowered to be your own advocate, okay? Because if you, on a normal day, is very overwhelming. As Dr. Henry mentioned, you could have 2 to 3 minutes. You may need to see sometimes 40 people on a daily basis for some of those doctors. And believe you me, they're trying their best to offer the most substantive care they can, but they're challenged. And as patients, I know is difficult to say that you may not get everything that you want out of a consult, but certainly if you prepare and you have a good relationship, many persons have great relationships with their GPs in the polyclinic service and rely on them a lot. Just really focus on the issues and try to have a discussion that's meaningful for you. And part of that is you preparing as well and trying to figure out what are the things that you really want to focus on, and sharing that with your physician so they can all find a common ground. Now, prior to COVID-19, that situation existed, okay, where there were challenges. We had discussions about nursing shortages across the the government system in Barbados in general. In the world, really, there's a nursing shortage, but certainly here, we had challenges with long waits sometimes at polyclinic services, and at the same time, our government is still trying to provide universal healthcare, which is admirable at a reasonably high level, compared to many other parts in the world, and particularly in the Pan-American region. So we have to put that into context, that we actually do have a pretty organized and good healthcare system where everyone can access it. I mean, 99% of Barbadians, and now non-Barbadians with the new initiatives, with the CARICOM extension, really can access public service in Barbados. And, that's a testament to what we do, what we're able to provide here. So, I mean, I will expand on that to say that, any given time, healthcare services are providing tertiary care at the QEH, which may involve, specialist outpatient clinics. It involves the accident and emergency. It involves all the services that occur on the wards, from neurosurgery to cardiothoracic surgery to cardiology, to intensivist care on the intensive care units. And then in the public service, kind of the polyclinics, you're providing child health, which involves wellness visits, vaccinations and immunization for children, NCD care for adults, along with acute care and chronic care of other illnesses. And when I say NCDs, I mean like the diabetes, the heart disease, the hypertension, as well as dressings, as well as mental health services, as well as women's health services, men's health services, infectious disease like HIV management and STI. So all these things were going on prior to COVID. And I could go on and on, which really made it difficult. And everyone can attest to the difficulties we had in trying to maintain a very high standard of care for our population and making it equitable for everyone. So in comes COVID-19, and we still have to make an effort to provide all those things. Plus, we have to do all these other things now. We build an isolation facility, and we're treating COVID there, along with basically the same system that we had before, the same challenges that existed from before. So it's important to understand that we're working through a very difficult time. I think we've been extremely innovative in finding solutions as a population, and understanding that context, it puts the onus even on us, even more as individuals, while we work through this period, to work on our health as much as possible. So I just wanted to paint that background before, and essentially the summary is that the reality right now is not great. I think there's a sustained effort to improve the human resource complement, particularly in the non-COVID spaces at the Queen Elizabeth Hospital, in the polyclinics, where there's been a concerted effort to reach out to as many persons, even engaging persons in the private sector, to backfill or fill in as much spaces as possible, to continue clinics to be able to run and services to be able to run as normal as possible. And this is all in an effort in the long run to incorporate COVID fully into our healthcare system. Because importantly, it's not going anywhere. I mean, that may seem like unfortunate news, but we have to think about how do we get to a point where we can be resilient and sustain our response to another healthcare issue, which is just one of the many healthcare issues that we deal with. And that has to be the mindset that, as individuals, we go forward thinking about COVID as part of the things we need to worry about, the same way we worry about our hypertension and diabetes and other things. That's a concern as well. And it will take some time. It's probably easier for persons like myself and Damien to be in that space, because we've been dealing with it in a very intense way for quite some time. But certainly, that's kind of the messaging, where we all have to just continue to aim towards a time where we can incorporate and find a sustainable path forward with COVID-19 there as well. And certainly at every single level in the population, I think in the healthcare system, they're trying to do that. But expect longer waiting times, expect challenges sometimes with navigating the systems, as Dr. Henry would have mentioned already. and expect that you may have to advocate again for yourself, not in an aggressive way, as has happened recently in some circumstances, but you need to, if something is wrong, you need to really get up and say so. And I think generally speaking, persons will listen if you're having a challenge. It's just sometimes they're so overwhelmed that it's difficult to see every challenge or every ill patient that's coming in. And keep in mind that they're constantly, even at the Queen Elizabeth Hospital, even at many of the polyclinics, you're also dealing with COVID-19 constantly. Persons presenting with symptoms in the middle of it basically was a peak of our, we're getting to basically a peak regarding our cases, and we're trying to keep as many people safe as possible. And I guess the plug here is that the community has to buy in. Public health is not going to work, and we're not going to be able to engage if we don't all work together. But expect that there will be some challenges over the next few weeks at least, that may be much more significant than you would have experienced before. So I think that people are going to try their best to help you, but understand that we're dealing with a very difficult situation, and we need to constantly be reminded of the effort that it takes to keep everyone safe and healthy. And that would be my plug. I don't know if Dr. Henry wants to add anything to that.
Before we move on to that piece, thanks for that, Dr. Broom-Webster, because it sounds to me like we all have to ensure that for the next couple of weeks or so, we try to stay as healthy as possible. But I just want to pause for a moment because we do have some questions in the chat. And I also want to acknowledge Dr. Adrian Lord has joined the chat as well, because I noticed he had joined on YouTube, and he actually posted a comment in response to, I think, your comment, Dr. Henry, on pharmacists. And Dr. Lord was basically saying that pharmacists, yes, they do indeed always help out. And that is true. I've personally experienced that myself. So Dr. Lord, welcome. And at some point in time, you never know, we may call on you to make a comment or two before you leave us this evening. But we have two questions in the chat. And the first one I'm going to pose to the doctors, because it says, what essential equipment, tools, or medication should I have at home in the event I have to home isolate? I have heard about oxygen monitors. Are these readily available as well for purchase? So that's the first question.
Yeah, so I think understanding the process of home isolation, it may be an opportunity to explain it. Personally, you may still need to double check some of the things that I say, because I haven't been intimately involved with it. I don't know. You're involved with it, Damien? I'm not sure.
I think Adana is running it, but based on what I was seeing,
they're providing most of the.
Yeah, they're providing most of the stuff.
Yeah, so basically they provide the so intended. So the first thing I would say is that if you are a candidate for home isolation or home quarantine, which are generally, so far I think they've said persons, fully vaccinated persons who have mild, basically asymptomatic, and I don't know if they've extended to mild symptoms. Those would be the ideal candidates. There may be other persons who could be incorporated as well, who would be considered very low risk. And I'm sure that it's all done on a case-by-case basis. So not to say that the vaccination status is absolute either, because there are lots of issues happening all the time. I mean, if at present, with 318 cases today, there's not going to be sorting and rationalization of that number of people within a 24-hour period. So certainly, there's a lot of, it's quite overwhelming to deal with that in itself. But you do receive oxygen. I know for sure the pulse oximetry or the pulse oximeters are in the kit that you're given when you're at home. Other things I would say in general, and I'm sure Damien would add to this, is if you have an underlying illness, it's really important to always have a supply of your medications. And this comes back to the comment about pharmacists and so on. At this point in time, it's really important to make sure that you're up to date with your medications and that you're adherent with your medications. Because no matter what condition you undergo, those keeping your blood pressure well controlled, keeping your blood sugar under control, those things will certainly give you a better chance of dealing with whatever illness you may have. And those are kind of the essential things that I would say if you're a person living with a chronic illness, to have your regular meds available. Persons will be liaising with you if you are isolating at home to help guide you through that process. That's really important. And you are going to be self-monitoring with a thermometer, really your temperature, as well as your outside of the symptom checks and persons calling, and your pulse oximetry. So those are some of the key things. Yeah.
But if you're a person like me, and I see that Dr. Lord mentioned this in the chat as well, where he said he advises persons to get their own pulse oximeters. And I'd want you to go a bit into explaining what this pulse oximeter does for other people, for persons really. But if you're a person like me, I tend to like to have my own little supply of things, because we recognize that the system is extremely overwhelmed. So in other words, I want to be prepared in the event I begin to feel ill, and maybe you are not getting to me as quickly as I want. So what, besides the pulse oximeter, which I want you to explain what that actually does, do I need to have I know you just explained I should have my own medications and so my usual supply, but should I have a thermometer? What else really would you recommend that I have in that kit, or would just the thermometer and the pulse oximeter be enough until I can get checked by a doctor?
Yeah, so I mean, I think it's always worthwhile to have your own supplies, and certainly we, as we would have experienced with some issues earlier in the COVID, in the pandemic locally, even outside of the pandemic, persons sometimes always have to get their own stash, as you say. You'd like to have your own stuff. So just to explain the pulse oximetry, essentially what we're saying is that one of the things that can happen unsuspectingly sometimes with COVID-19 is that your oxygen levels, meaning the amount of oxygen that is in the blood, can drop quite quickly. And sometimes you may not even have significant symptoms. Usually when your oxygen drops, persons may start to breathe quite heavily, and they may feel short of breath. And sometimes in COVID-19, that does not really happen. You may get very low oxygen levels without showing symptoms overtly. And that's why we recommend, and that sometimes can be a precursor, or that can happen before you get really ill. So by monitoring your oxygen on a regular basis, it gives you an opportunity to kind of get ahead when things may start to deteriorate. And essentially all that, it is a device that basically you fit it on your finger, and it shines infrared light through the fingernail, and basically that calculates what level, as the blood passes under the fingernail and the light hits the red blood cells, it gives an idea of how much oxygen is located, how much oxygen, how your oxygen capacity is at that point in time. Things like fingernail polish, if persons can obscure the reading, if persons are really, dehydrated, or they have very low blood pressures, that sometimes can make it difficult for that reading to work as well. But again, those are some of the things that you can do. I would recommend a thermometer as well, because if you're having very high temperatures, that's also something to be concerning. Certainly antipyretic agents, and I just mean things that will stop the fever. So paracetamol is always good, or good old paracetamol, or that will help with any fever-like symptoms. But outside of that, your essential medicines that you need to manage whatever underlying condition you may have. Now, it's always important to try to have some access, as you mentioned, to have your own supply. If you have a doctor that you are close to, somebody like Dr. Henry, myself, Dr. Lord, and you know that you're at home, make sure that you have a close relationship with your physician, as all of us have experienced. I'm sure Dr. Henry has gone through it, Dr. Lord, where our patients may be waiting at home for pickup or something like that, and they're constantly liaising with us to find out, how am I doing? And we do that all night, okay? We're open for our patients and we're constantly interacting. And that is actually some of the best help that you can get, because in some cases you may really deteriorate and you may need to get down to the QEH, for example, which is not ideal. But if you really are not feeling well and you are deteriorating and you haven't been moved to an isolation facility, you really don't have any choice at that point in time, and you should seek emergency services, and that can help if you have a GP or someone that you can coordinate with. So an essential service is having someone with medical expertise on your side that you can liaise with as well, and that's kind of what the home isolation or home quarantine structure is trying to facilitate, along with everything else that I would have mentioned.
Well, I have to say I'm very happy that I have the cell numbers of all you doctors here handy on my phone, that should anything happen, I will have access to private medical doctors to help me out, hopefully. So we move on to the next question in the chat, which is, our kids are also challenged in this new and difficult time. What is best recommended in terms of managing their mental health care, particularly teens? I don't know if Damien, Dr. Henry, you want to handle that, since we just had Dr. Brown Webster talking quite a bit.
That's okay. Well, first thing, you have to have a good rapport with your kids in terms of, and I think that's the basis in terms of keeping an eye on stuff, because a lot of parents, if you don't have a good relationship, your kids may be going through stuff and you don't know about it. And I think that's probably the biggest struggle that most parents kind of have to deal with, in terms of each other experiencing something, but they don't know because they don't have that rapport. So good rapport is important. And if you have a good rapport, you then have an idea of what is your child's norm. And even if they don't come out and verbally say to you, "Mommy or Daddy, I'm not well," or "I am not okay," you can actually read from their body language and how they're behaving, that things are not going well. Some of the classics in terms of the teenage child, moodiness, in terms of fluctuating moods, some days happy, some days sad, outbursts, maybe rage, anger, frustration. And these are children who are not normally, don't normally behave in that kind of manner. Withdrawn, in terms of, I'm in my room, I don't want to come out. I choose not to interact. And, the classic thing of anhedonia, where person doesn't want to, all the things that they would have enjoyed before, like say if they're avid, they raid or play tennis, or they, have a particular video game that they like doing or playing or whatever, you find that they're not taking part in their activities that they thing, and they're refraining from discussing or talking with friends. And these are some of the telltale signs that all is not well, and that this person is actually crying out for help. They need some level of intervention. So I saw Lana also put some stuff there in the chat that you can actually pull up in terms of well-being of kids, so you can access that as well, to give you a little bit more info. But those are some of the basic telltale signs that you can look for. And you don't have to be a counselor, you don't have to be a specialist. All you need to do is recognize it, and know where to seek help, and get in contact with someone who could actually be able to assist you in this situation. So it's recognize and then yell for help. I think your mic is muted.
Sorry, yes, I apologize for that. So I'm going to go back a little bit to Lana to tell us, you mentioned earlier, and I can attest to this, that I would say you can do a lot of damage in a 15 to 20-minute workout. So when she says that, ladies and gentlemen, believe me, it is actually true. But can you share some, maybe a little short routine or some exercises that people can perhaps do within a 15 to 20-minute segment that you can easily share to persons?
Oh, there's so much. Very much depends on what you have available to you. With like I was saying before, you have to get very creative. We've been filling water bottles with, sand and those kinds of things to make little weights. But the basics are always still very much there, your squats, your lunges, your, push-ups, crunches. And basically you want to do a little something for the lower body, you want to do a little something for the upper body, and you want to do a little something for the core. So it really is, you want to get a full body workout, and be able to, put a little cardiovascular in there, just to keep the heart healthy.
Okay. So I guess things like just jumping jacks and those kind of things will be the cardiovascular type of exercises which you're talking about, little jogging on the spot and those kind of things for persons who may not want to do as high impact activity as others, and perhaps maybe some, or maybe the I don't know, maybe a little bit of the yoga type exercises as well, which would kind of help people with a little bit in their mental space. What do you think about that?
No, yoga actually is, I think people underestimate yoga. Because yoga requires a lot of control, a lot of core stability. So although it may look quote unquote slow moving, it really requires still a lot of muscle strength and core stability. So yoga is still very fantastic. I personally like yoga from that standpoint, for a mental recentering type of standpoint. It is very much a solo workout where you focus on you, and you can focus on breath work and those kinds of things. So I find yoga, Pilates to some extent as well, tend to draw you into yourself. But it does not have to be a jumping jack or a squat or a burpee. Like I said before, yoga, stretching, and like somebody saying, exactly, your good old, it is really about movement, finding a form of movement that you can continuously do. And like he's saying, gardening will seem like a simple thing, but you're pulling weeds and you're moving around and you're lifting and stuff. I think people need to make a focused effort towards movement. I think we underestimate even so much as, the gardening, the getting out there and moving and finding a mindful way to be physically active. I hope that COVID has made people more aware of the fact that they need to move. I think being at home, I think people are feeling the itch a little more to get out and move. I found, just when you could get back out and you could go to the beach, there's a lot of people on the beach walking and getting back to the simple forms of movement, walking and swimming and those kinds of things. It does not have to be like I said, a squat or a jumping jack or a thing, but I just think that people need to make the effort towards making a consistent effort towards moving and exercising.
Okay, thank you for that, Lana. Now, back to the doctors now. So tell me, what are some of the tests that both males and females should go to their doctors asking for, to get a general gist of what, to get a general assessment or general overview of what their health is like? Are there maybe 5 or 6 basic tests that we should perhaps be asking our doctors to do for us? Because at the end of the day, I know sometimes people go and they say, okay, I'm going for my annual checkup, I'm going for my annual physical. And in some cases, for them, that means they go to the doctor and the doctor listens to the chest, and you look your throat and your eyes and those basic things. But for some people, that's the extent of it. But are there other tests that we should perhaps be asking the doctors about, that we should perhaps have performed? Could you touch on that for us?
I'll jump in on this one first. Also, if you look at the baseline in terms of our population in Barbados, some of the major health challenges that we have as non-communicable diseases. So start with the most obvious is basically most of us are not at our ideal weight. And so that tags along a whole lot of stuff with it. Then there's the whole challenges of family history of diabetes and hypertension. And these are things that are, can be easily done in the office. Checking person's blood pressure, checking person's blood sugars. But in addition to having your blood sugar done, having a glycosylated hemoglobin, explanation of that is basically the infamous 3 mouse test, which actually looks back a little bit and helps us to see what your blood sugar levels were over the last 3 months and what fluctuations or variations there may have been. And it's kind of a very strong predictor of, not only whether you're pre-diabetic, diabetic, but also in terms of your long-term well-being, in terms of if you're diabetic, those persons who have elevated HbA1cs tend to have a poor prognosis in terms of overweight and stuff like that. The other things that we need to also look at in terms of kind of pairing along with doing your blood pressure is checking your kidney functions, which is basically urea and electrolytes and a glomerular filtration rate. And this is basically the basic things, and this can be coupled along with a nice spot urine, which tells us about, whether you spit out albumin, which is or protein in your urine. And these are simple things that can be done, relatively quickly, and would give us a kind of like a bird's eye view of what's actually happening. In addition to these things like your cholesterol levels, because that's another significant predictor of cardiovascular disease. So between hypertension and your cholesterol, your blood pressure levels and your cholesterol levels, that would kind of give us a reasonable predictor of your likelihood of a heart attack and stroke, whether you're male or female. So these are some of the things that you can quickly look at. And then if you're throwing the net a little wider, cancer is the next big cause in Barbados. So we're looking at our cancer screens. So from the male side, once you cross, well, depending on, some people say 35, some people say 40, but depends. If you have a first-degree relative who would have had prostate cancer in their 40s and 50s, I would say probably as low as 35, you start doing your PSA secretly every year. And you're not just the total PSA, but you want to do PSA plus a measure of what percentage of that PSA is bound versus what percentage of that PSA is free. Give us a little bit more information, and in terms of giving us a better shot at saying, well, is this elevation related to cancer, or is it a benign issue? There are a number of other cancer screening stuff, but the other big thing that we see here in Barbados is breast cancer. So for the ladies, mammograms, it's basically another big screening thing that you have to have done. But beside the mammogram, self-examinations, there was a course we went to a few years ago, which basically said, your breast best, and you know it better than any doctor. So you are more likely to pick up a abnormal lump or abnormal area in your breast faster than the doctor will pick it up. So self-examination. And if you have a partner, your partner should know your breast fit as well. So, that person can actually assist with the examinations. And sometimes that's how people pick up lumps. their husband or their significant other says, to them, hey, I felt something abnormal here, and subsequently they have it checked out, and a number of people, realize that they've had a lump or in that kind of way. So these are little things that so mammograms, PSAs, and then the other thing that's a big issue in Barbados is colon cancer. Now, the colonoscopy, which is recommended at the age of 50, but I do say 50 is great for persons who've had relatives who've had colon cancer stuff in their 60s, or if you're just waiting for your normal screening. But there are those people who have first degree relatives who've had colon cancer in their 50s. And we've seen a few ugly cases where people have been diagnosed even in their 40s. So those individuals, I would say 10 years below whatever age your first degree relative would have been diagnosed is when you want to have your first colonoscopy. Now, colonoscopies tend to be a bit pricey, and so a lot of people say, I can't really find that money in terms of my insurance, but there are a couple of things that you can do. There's the fecal occult blood test, and then there's the FIT test, and then the M2PK test. These are stool tests. We deliver a bit of stool to the lab, and they're a little more specific and kind of help us to determine whether or not, you have higher risk of having colon cancer. And then you have the cancer markers such as CEA and stuff like that that you can also do as well. So simply put, in terms of for the take-home message when you go to your doctor, you don't need to remember all the big names. You need to have some sort of screening and evaluation to see if you're a diabetic, some sort of screening and evaluation to check on your blood pressures and subsequently your kidney function. And then you want to do, if you're male, screenings for prostate and colon, and if you're female, breasts and colon. And those are the general biggies, in addition to the usual pap smears and stuff that the ladies get, which check for cervical cancer. But these are some of the broad tests that you can have, and that will give us an idea. And on all of this, FBC, a full blood count, which will kind of guide us a bit in terms of what your hemoglobin level is and stuff like that. And that will pick up conditions where people have things, non-malignant conditions, things like fibroids, where people have heavy cycles and stuff like that, and the blood counts can fall. But it will also help us to pick up malignant conditions in terms of if you have persons with a very low blood count or abnormally high white blood cell count. These are things that will kind of point us in a direction. So these are just a few things that you can ask for, and it's not going to cost you a mint. And you can actually have a pretty good evaluation. And if you do these things annually, that would actually give you some pretty decent ideas, especially once you've crossed the age of 30. Having this stuff done annually is a pretty decent idea in terms of our population, because diabetes is very prevalent, hypertension is very prevalent, and unfortunately, recently, cancer has been, very prevalent as well.
Okay.
I don't know if the others
Thank you
have anything else to add.
Okay, thank you, Dr. Henry. Well, it seems as though all three of you have, well, to me, have done very thorough presentations tonight. And it seems as though the presentations were so thorough that we didn't have many questions posed to us tonight. So at this point in time, if there are no other questions in the chat, which I'm not seeing any at the moment, I'm going to invite all three of you to give some closing remarks before we move to our closing prayer and vote of thanks. So, Lana, do you want to go first again?
Sure, no problem. I just want to close and say thank you to everybody. I think there were a lot of very good points. I think we can all see that we need to really make the effort to make health our first wealth, to really be mindful in what we're doing. We need to be mindful in this environment to stay sane, to look after our health. I encourage everybody to eat as nutritiously as you possibly can, support your body. I think that if you can support your body as much as possible with movement and nutrition, then you will give Dr. Broom Webster and Dr. Henry and Dr. Laura the easiest possible time when you go up to them, right? So do as much as you can where you are, start with what you have. And, you know, I encourage everybody to do their best in terms of looking after their health and stay safe.
Thank you, Lana. Dr. Broom Webster?
I just want to say thank you again for inviting me to the conversation. I really do think that this is the kind of example of, these kinds of initiatives are the kinds of examples of community engagement that can be mirrored across the entire society to really have, great impact on our entire healthcare system. And I just want to congratulate everyone here for coming out and participating. It's great to have a multidisciplinary panel. I agree with Lana wholeheartedly. And I'm sure that once everyone listens to some of the advice tonight, I'm hopeful that it can help you not only alleviate any acute issues you have, but also give you a little confidence in how to navigate all the anxieties that come with managing your health during this time. Importantly, when we speak about health, this whole dimension of discussing wellness, we want people to live well. Yeah, doctors aren't out here just trying to do tests and poke around and so on and so forth. We're engaged in seeing our community and our individual patient populations thrive. Okay, and that's what we all aim for. Despite the fact that you may have a particular issue on a particular day, we want people to thrive. We want people to live well, to have great quality of life, most importantly, and hopefully that extends to a great quantity of life. So I just would encourage everyone to take little snippets from what you've heard here tonight and to do, to visit your doctor regularly. Still, even in the pandemic, you still should be visiting for those wellness checks, for those follow-ups if you can, because they're really vital. We're all now much more prepared in keeping our spaces safe, and those are the kinds of visits that do make a difference as much as they possibly can. Those annual visits, those visits every 4 months to check up, they're really important, and we're seeing it even more so than we've ever seen it before because of the number of people who have missed their appointments or whatever, who end up in difficulties. So I know it's difficult. It's a very anxious time, but I encourage you in the safest way that you can to still maintain that relationship with your healthcare professional. Thank you very much.
Thank you, Dr. Broom Webster. And now, last but not least, Dr. Henry.
Thank you again for having me on the conversation this evening. Mirroring the comments of my fellow panelists, in terms of your health is your most important and best resource. Regardless of all the assets that you may possess, if you don't have health to enjoy them, it is a waste of time. And so maintaining that even in this time is critical. Most people over the years have, might have, kind of put health on the back burner at times, especially in terms of preference to career and those kind of things. But I implore most people during this time, to actually, take a grip on things and, basically not only your physical health, but your mental health in terms of having that as a great priority. Maintaining balance, as Lana was talking about, is critical in terms of having time for work, time for play, and time for yourself. And, in your hobbies, and finding creative ways of doing it that you are not putting yourself at risk. Your checkups and those things are essential, as mentioned before. But my main takeaway message for everybody here this evening is basically in terms of, even if you are not a person who normally goes to the doctor and that kind of stuff, it may be wise to have yourself checked out at this time, because a lot of persons are just under a ton of stress. And this is not short-term stress that people have been experiencing. It's basically long-term stress. And there are a number of individuals who have not seen for a few, a while, and they just came to the doctor because they were feeling unwell, and a number of persons have transitioned to becoming diabetic. A number of persons have elevated blood pressure, and to the point that they are have to be on more than one medication. And these are people who were previously well prior to COVID. So the environment, just the stresses of living and hoping and surviving, is actually taking a toll. On a sad note, the number of persons who will be seeing with newly diagnosed cancers in this time frame has also increased. And unfortunately, a number of these persons, when they present at rather advanced stages. So keeping a close tab on yourself during this time is critical. This is a good forum, and good advice that was given this evening from a number of health professionals. And, it is wise that you look after yourself. Nobody can look after you but you. And I hope that, in the long run, that, you will take the best care of yourself so that you can actually not only survive COVID, but, actually come out with a better outlook and a more positive outlook and a better health at the end of the day. Owning your skills in terms of self-care and, having a better exercise program and better diet and general better overall health. I wish you all the best. And as the, text Bible says, beloved, I wish above all things that you will prosper and be in good health. Well, good evening.
Thank you, Dr. Henry. Before we move to the closing prayer and the official thank you, which will be led by Mr. Michael Brown, who is a member of our Conversations Committee, I just wanted to say a personal thank you to Dr. Henry, Dr. Broom-Webster, and to Lana, who all three of you willingly accepted the challenge and willingly agreed to come forward and share your expertise and knowledge with us this evening. And for that, I just want to say a personal thank you. Of course, I just also want to tell you that we also are in a habit of peeping back and inviting people that we've had before to some of our other conversations, depending on whatever topics arise in the future. But thank you for that. And I now invite Michael to lead us in a word of prayer and to give the official thank you.
Thank you, Lana. In terms of the vote of thanks, I would have been taking my notes, but I will commend the three panelists on their wrap-up statements because they succinctly restated what I was going to say. And I was just sure that when the committee looked at this topic, one of the things we spoke to, and Dr. Henry just alluded to it, that we knew there was a concern with persons because of COVID not doing their regular visits to the doctor. And Dr. Henry just stated something which is very instructive, that he said there were persons who were well before COVID, and now with the transition and the going into probably 2 years of COVID, persons have become ill. So at least, Lana, we were on the right note in terms of our discussion and having the topic. So another thing that was stated, and in terms of Lana, speaking about make health our first wealth, because in terms of the comments made, we now recognize that initial fear in terms of reaching out to your medical practitioner, the anxiety of that has gone because persons are now reaching out and recognizing that they still have to interface with their own medical practitioner. And one of the other things that was highlighted with regards to what we were expecting to come out of this discussion is there's an infrastructure in place to help us with the whole aspect of anxiety and concern, and with the mental health situation that we are faced I said because of the whole aspect of COVID, the concerns, the challenges that we face as a population. But for what we've heard tonight, there are opportunities, there's the infrastructure, there's the opportunity for us to be given help. And once again, the church has been challenged as a place of comfort and confidence where people should be able to reach out and be given help. Not forgetting our children. And over the months that we've had these discussions, we've spoken to the challenges that are faced by our youth in terms of persons currently in school. It is new for them. We are social beings, and the challenges that are faced by children. I think tonight we were well served with what we have been told. We know where we need to go. We've been asked to take responsibility for our health. And Lana has told us we need to move, and that will help us. So thank you to the three panelists. I also thank Lana for an excellent moderating, and also like to thank Sandra Brown, who would have given us our opening prayer. I will now do the closing prayer. We bow our heads. Lord, again, as we are in your presence, thank you for what has been said tonight. Open our minds and our hearts to what we've been told. Help us not to be as anxious as we've been. Let us reach out to those who are able to help us. As we leave this space, let's be ever mindful that you, as our God, is in charge. May the grace of our Lord and Savior Jesus Christ and the love of God and the fellowship of the Holy Spirit be with us all now and forever. Amen.
Amen. Thank you, everyone, and good night.